This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Like destiny played a prank on 31-year-old Apple Roma. Apple, a medical technologist, has been working as a section manager at the Diabetes, Thyroid, and Endocrine Center of St. Luke's Medical Center for 9 years when she was diagnosed with thyroid cancer.
Nagtuturo kasi kami ng ultrasound ng thyroid sa mga trainees namin. So, minsan, nagiging test patient ako, tapos yung partner ko nagtuturo. So, this is the thyroid, this is the right, the left, the middle, and the carotids, ganyan. Tapos, accidentally, nakita na may bukol sa right thyroid. After nun, ma-recommend for biopsy, lumabas nga na thyroid cancer siya.
To prevent further damage, Apple underwent a surgery to have her thyroid removed.
Nakaka-depress din nung una. Kasi I have to undergo surgery and then therapy kasi more or less alam ko kung ano yung mangyayari sa akin. Naka-recover din ako mabilis after nung depression because of the support of our doctors.
According to a 2010 study of St. Luke's Medical Center, thyroid cancer ranked as the 4th cause of death among women in the Philippines. Thyroid problems arise when there are imbalanced hormones produced by the thyroid.
Simple signs and symptoms that can lead you to the diagnosis of having a thyroid problem. Well, number one is most people are concerned with weight. No? You gain weight or lose weight very fast. These are probably signs and symptoms of having problems in metabolism. Second is, if you notice, you can look at your neck. If you notice there are enlargement in the neck or some hard nodules in the neck, that is already a sign that you have probably goiter, no? An enlargement of the thyroid gland.
Several treatments are now available to help patients with their thyroid disorder.
There are now a variety of ways to manage the thyroid. Of course, there is surgery, but even in surgery, no, we have the minimally invasive. If you don't want to have a scar, we do that here in St. Luke's. No? And if you have what we call a minimally invasive surgery, we also do it here. And we have radioactive iodine, wherein we try to burn the thyroid gland. And sometimes we also use medications to help resolve the functionality of the thyroid gland.
What are the symptoms and complications of thyroid disorders? Who are more prone to thyroid disease? How can we avoid thyroid ailments? Find out the answers tonight on MedTalk.
Joining us tonight is Dr. Joy Castillo Fontanilla, endocrinologist from the St. Luke's Medical Center. Also joining us is Dr. Rochelle Cauton-Valera, endocrinologist from the Philippine Society of Endocrinology and Metabolism. Good evening, doctors.
Good
Welcome
evening.
to the show. Tonight, we'll be talking about our thyroid. First, let's locate our thyroid. Where exactly is it located and what is its shape?
Well, basically, it's in your neck. I can show you. This is
yes, please.
This is our windpipe or trachea, and this is the thyroid gland. It's like a butterfly-shaped thing in front of your in front of your neck. So it's just underneath your Adam's apple.
Okay, so the men have an Adam's apple. It's easy for them to locate their thyroid. How about the women? Do we also have a little apple
Yeah,
there?
we all have actually the Adam's apple, but in guys, it's just much more prominent.
What is the function of our thyroid in our body? Dr. Valera?
Well, your thyroid gland actually produces thyroid hormones which serve to regulate metabolism or how efficiently your body uses energy or how efficiently it runs. It also regulates the function of all your organs. And in children, it's important because it's important for growth and mental development as well.
Mm-hmm. You mentioned the importance of the thyroid. What are the other factors that contribute to the importance of our thyroid in our body?
I guess you can see that in thyroid disorders. Now, we usually see a lot of patients that say, hey, I'm gaining weight, I must have a problem with my thyroid.
Why do they identify it right away with the thyroid?
Well, maybe because I think even lay people already know that the thyroid has something to do with the metabolism. And if metabolism slows down, they associate that with gaining weight. And you know, Filipinos, you'd rather attribute it to something else rather than
Yes.
I ate too much or I don't exercise. But
Yes.
a lot of people may have a thyroid disorder, which may lead to weight changes. So we have to be aware of that as well.
So weight changes, weight gain, and weight loss.
Usually that would be their primary concern, but there are other symptoms which are common as well.
Okay, so when the thyroid, we've mentioned and we've talked a little bit about when your thyroid is functioning well or how active your thyroid should be. So when your thyroid is not as active and you manifest the signs and symptoms, as you mentioned earlier, Dr. Valera, that you may be gaining weight.
Yeah.
Oh.
So, well, in endocrinology, it's usually, to put it simply, when we have hormones, the problem would be there's too much or there's too little, just to put it simply. So if you have thyroid hormones, you can have too much, so we call that hyperthyroidism, like hyper, super, overactive thyroid. You have too much of the thyroid hormones, or if you have too little of the thyroid hormones, your gland is not producing enough, then it's called hypothyroidism.
So let's talk about hyperthyroidism. When you're producing too much of it, what happens to an individual when you produce too much of this hormone?
If you have too much thyroid hormone in your body, it can affect, I think, from head to toe. So your heartbeat can be very, very fast, so people can complain of palpitations. You can also complain of feeling warm or hot all the time. So even if in an air-conditioned room, you may be sweating while everybody else is comfortable. And also you can have problems with your bowel movements. People have to go to the bathroom quite often. After they eat, they have to go.
Okay. You were about to add something,
Well,
Doctor?
since if you think of thyroid hormones simplistically, you can think of it like the electricity going through an appliance. So you can imagine a 110 voltage appliance that you plugged into a 220 appliance. Like if it's an electric fan, it will suddenly start moving very, very fast, and eventually some explode, right? So you can imagine all your organs moving too fast. So some people, they talk too fast. As Joy has mentioned, they're sweating all the time. They feel hot all the time. They may feel very irritable or restless, and they may even exhibit tremors as well.
And the physical manifestation of someone who has a hyperactive thyroid is that they're very thin and that their eyes tend to bulge. Why is that?
Well, it's usually the cause for that is an autoimmune problem we call Graves' disease. It was named after Dr. Graves.
Okay.
Yeah. And basically, your own body is attacking itself. So it's attacking your thyroid and making you produce too much thyroid hormone. And it can also attack the muscles around your eyes so that they swell up and you bulge out.
Would you have an example of someone who has a
Hyper. Well, this would be one.
Hyper.
The thyroid gland compared to the normal one.
Yes.
It's much bigger.
Okay.
Yeah, it can be much bigger and it can grow even bigger. Yeah. And these people tend to have very high thyroid hormone levels, and they're like a car on the racetrack, just
moving around and around, and they expend so much energy.
Yes.
Yeah. So usually they complain that they eat so much, but they're losing weight. So that's another thing. And also their skin may be thinner. Sometimes they'll complain that their hair is falling off faster.
So is there a certain age when one notices it, or it spans through all ages?
It can happen at any age, but it's commonly seen in women in the reproductive age group.
So 20s?
Yeah.
At the 20s. Sometimes, we might identify someone who has a hyperactive thyroid as just someone who's very energetic, who just has a lot of energy to expend.
Sometimes it's like that. Sometimes.
How about in kids? We speak of energy. Kids have so much energy. So how do you identify one who has a problem with their thyroid, in this case a hyperactive thyroid, and one who's just being a kid, being very energetic and being very playful?
A simple blood test can solve the problem. You can tell if someone has a thyroid problem, both underactive or hyperactive, through a simple blood test.
Okay, you mentioned, Doctor, a hypoactive thyroid. One's thyroid who is not as active as one diagnosed to be hyperactive. So let's talk about the hypoactive thyroid. What does this mean, and what are the physical manifestations of one who has this?
Well, basically the opposite of what Dr. Valera explained earlier. Someone who has an underactive thyroid tends to gain weight or tends to complain of feeling cold all the time.
I feel cold all the time.
Yeah. Or they're constipated, they're sluggish. Some will feel very depressed and lethargic.
Okay. And why is this? What happens to one's thyroid when they feel all these symptoms?
Well, since, as we said earlier, your thyroid hormones really serve to regulate function of all your organs as well as metabolism. If you have too little, well, you're like a 220 appliance that was plugged into a 110. It's functioning, but it's very slow. So as Joy has mentioned, everything slows down. And since you are not using your energy properly as well, then you tend to gain weight as well. Then you're constipated, and you feel lethargic or sleepy all the time, and yun nga, pwede ring depressed.
So you again have to take a blood test. Kasi sometimes if you're sleepy all the time, other people will just say, "Hindi, I'm just tired. You know, I had a long day and I'm really just sleepy." So is there a particular physical manifestation that one has a hypoactive thyroid? If the hyper, they lose so much weight, the hypo gains weight?
They tend to gain weight, but actually weight gain, people keep saying, oh, it's my thyroid, it's an underactive thyroid.
You always blame it on the thyroid.
Yeah, but it's really more of an overactive fork and spoon.
Okay. Your love for eating lang, yeah. So gaining weight should not be the gauge?
Not just that.
Not just that.
A simple blood test can solve everything.
Okay. We'll go back to talking about our thyroid, how underactive or how active it is. But first, we'll go to our Twitter questions. My mother was diagnosed with hyperthyroidism. Is it possible that I can inherit it? Okay.
Well, it's possible. There are certain cases of familial Graves, as Joy has mentioned, Graves' disease. It can be familial, but for some people, unfortunately, it just so happens that you're the only one in the family who gets it. So it's also possible that it happens that way. But if you have a family history, as with any other illness, if you have that family history, it makes you more aware. And then you should be more conscientious about checking yourself up. And as Joy has said, it's very simple to check it out. You just do a simple blood test. And we can even detect subclinical diseases, which basically are diseases which have not reached clinical proportions or are not obvious or do not cause symptoms, but only show abnormalities on the blood test.
So it's really wise to monitor how the changes in your body. Like I remember reading that if one has a hyperactive thyroid, the eyes tend to bulge, and you will notice this. You know, in this day and age of selfies and everybody taking pictures, you will notice a change in one's appearance because of this.
Well, yes, that can happen if you have what we call Graves' disease, but there are other causes of hyperactive thyroidism, hyperactive thyroid diseases, which do not cause those eye signs. And there are other people who have no symptoms at all, like especially in the elderly, they might experience like heart problems or rhythm abnormalities when in fact it's really a thyroid problem, and they have none of the symptoms that we mentioned earlier.
Yeah, so it can be very, very subtle.
And because it's very, very subtle, again, we have to be very watchful of all these signs and symptoms. And if we feel something or we notice something, then have a blood test right away.
Yes.
Doctors will talk more about this when MedTalk returns.
Did you know that Pierre Joseph Desault was considered to be the father of thyroid surgery? The first documented partial thyroidectomy was carried out by Pierre Joseph Desault in 1971. He removed a 4 cm mass from the thyroid through a vertical incision, tying of superior and inferior thyroid arteries, and then dissection of the gland from the trachea.
We are back here on MedTalk, still talking about thyroid conditions. Doctors, how about goiter? Is it a manifestation of someone who's a hyperactive thyroid or a hypoactive thyroid?
Basically, goiter is just a fancy word for enlarged thyroid. So it can happen in people with hypothyroidism, it can happen in people with hyperthyroidism, also can happen in people with normal thyroid function. It's just that their thyroids are enlarged.
Why does this happen? Would you have a...
Well, it can look like
It
this,
can look
or
like
like this.
also, okay.
Yeah.
So why does that happen? Why does goiter happen?
The most common worldwide cause of goiters is iodine deficiency. Yeah. So about 40% of the world's population is at risk for iodine deficiency. In the Philippines, since we've been using iodized salt in a lot of the regions in our country, the prevalence has gone way down. But in the mountain provinces, you know, where they have no access to not much access to seafood, then iodine deficiency is much higher.
So iodine should always be part of our meals.
It should be part of our diet, yeah,
So
because your body can't make iodine.
Okay, so we have to take it and we have to get it from
From
seafood.
food, yeah. You can also find it in eggs and dairy products.
Okay. Why does our body need iodine?
Because iodine makes up thyroid hormone.
Okay.
So thyroid hormone is made up of iodine and other proteins.
Okay. Doctors will talk more about that. We'll talk more about the treatments and medication. But first, we have a question from Facebook. I'm 4 months pregnant now and I have goiter. Will this affect my baby?
Well, basically, as Joy has said, the thing is when lay people use the word goiter, it can refer, as Joy has said, the way we use it, meaning that it's an enlargement of the thyroid. But for other people, when they use the word goiter, it really means there's a problem with my thyroid. Either I'm hyperthyroid or hypothyroid. Since the person who sent the question didn't really say if it was a goiter or really a hyper or hypo, the answer would really depend on what the condition is. If she has a goiter, meaning an enlargement of the thyroid, but the thyroid function is normal, then this should not affect her baby. But if she is hyperthyroid, meaning her gland is overactive, of course this can affect development, she can have a difficult time. And if she is hypothyroid, the same is true as well. Meaning that if you're pregnant and if you have hypo and hyper, you have to ensure that you see your doctor carefully so that medications are given at the right dose.
Can she pass on this condition to her baby?
Yes, it's possible.
But again, she has to have herself checked, and to balance these hormones, she has to see a
But it may not manifest
doctor.
right away in the baby, you know, when they're born. But I'm glad that we have, you know, we've included newborn screening, the thyroid function. We've included TSH in the newborn screening, so that babies are now screened for thyroid problems.
So if the mom, again, we'll go back to the mom, the Facebook question, the mom is complaining about her thyroid, it will not affect the baby.
Well, if it is a non-toxic goiter, meaning that it's just an enlargement of the thyroid, but your thyroid function is normal, then it should not cause any problems, except if the goiter is so large that she cannot breathe anymore or is causing obstruction. But if she has hyper or hypothyroidism, then definitely she should see her doctor. Her blood tests have to be done, and medications which are appropriate will be prescribed and titrated accordingly. Because as the pregnancy progresses, the dosage also has to be adjusted. And we have to bear in mind that some of the meds can affect, of course, cross the placenta, affect the fetus, so we really have to adjust those.
We talk about medications, so let's now go into the medications that one needs for a hyperactive thyroid.
Yeah, for hyperactive thyroid, we have 3 ways of treating it. One is to give oral medications, and that's usually given for a year and a half. And then another option is for radioactive iodine, which can actually destroy your thyroid. Okay. In people with hyperactive thyroids, that is one of the recommendations. And another option is surgery, and that's usually reserved for patients with very large thyroid glands, wherein the other 2 may not work as well.
while you were mentioning that, how about the tests that are done? What type of blood test is done to determine if you have a hypo or hyperactive thyroid?
We call these thyroid function tests. So you just get a needle prick, and then your blood is extracted, and we order for a free T4 or a free T3 along with a TSH or a thyroid stimulating hormone, which are readily available in almost all the hospitals and all the laboratories nationwide.
Even without, but you have to get the prescription from the doctor. You have to get the go signal from your doctor to have these tests.
I think certain hospitals or laboratories do allow it. Other hospitals need a request from the physician.
Okay. So we go back, we were talking about the hyperactive thyroid and the treatments and medications. About the hypoactive thyroid, to balance those hormones, what are the proper medications?
If you have hypothyroidism and you have too little of the hormones, we just replace the hormone. So we give levothyroxine, which is basically the name for thyroid hormone. So we just give it to them. It's a simple tablet. It's very cheap, and you just have to take it once a day.
What does it do? How does it affect the thyroid, these medications?
Well, basically, the levothyroxine for the hypothyroidism, since you do not produce the thyroid hormone, you're just supplementing or giving what is lacking. So it will perform exactly what thyroid hormone does, which is to regulate your metabolism in the proper way.
And these regulate your metabolism, so your being diagnosed of a hyper or a hypo becomes normal already.
Yeah, once you're at the right dose. And you need to be monitored periodically.
So you have to balance the dosage.
The blood tests have to be monitored.
Okay, so, and then you recover from this. It never comes back? Or is it with you forever?
It depends on the cause of your hyper or hypothyroidism.
Okay, so it can be cured.
It can be cured,
It does not need to recur.
Well, if it's Graves' disease, it's forever. It's a lifelong thing.
So you have to take medications for life.
Medications, or one of the other options that Joy has mentioned, the surgery or the radioactive iodine therapy, which are the definitive therapies. Because, some patients, if you tell them, you have to take these pills for 1 to 2 years, then I'll try to stop them. Maybe you'll go into what we call remission.
Yes.
But, that only happens in about 30%. And some patients, if they compute how much that costs, they'll say, the amount I spent, I should have done the radioactive iodine a long time ago. So some patients, they do opt for that already because, of course, medications do have side effects as well. So some patients, they don't like that.
And so for us to keep our thyroids healthy, what should we do? What should we eat? What kind of lifestyle should we have, Dr. Joy?
Well, basically, just living a healthy lifestyle. Eat a balanced diet. Make sure you have iodine, you're well supplemented iodine. Because too much or too little is not good for the thyroid also.
Doctor?
Well, basically that, as Joy has mentioned, you just have to ensure you have adequate iodine intake. But unfortunately, for some of these diseases or most of these diseases, there's really nothing we can do to prevent it, no? And like if you have Graves' disease, there's nothing really we know that can stop it. If you are destined to have it, you will have it. So it's not like diabetes or let's say hypertension or cholesterol na you watch your diet, this will not happen to you. But with the thyroid, sometimes that will not happen. The only thing we can prevent would be if it is iodine deficiency. And if we have iodine in our diet, which is sufficient, then you don't get these problems of having too much or too little of the iodine. But a lot of the thyroid disorders that we have, there's no means to prevent it really, unfortunately.
But fortunately, we have the medications, and fortunately, we can watch
we can
what
control
we eat.
it.
We can control it. And fortunately, we have doctors like you to help us along the way. Doctors, we have a question from Twitter. I was advised to have my thyroid removed. This was what you were saying earlier. What are its effects on me?
The effects, I guess they're asking about the effects of the removal of the thyroid.
Yes, yes.
Well, complications of thyroid surgery are related to cutting up. So anytime you cut up somebody, you can be prone to infection or bleeding. And because it's in the neck, our parathyroid glands are there also. And those glands are in charge of our calcium levels. So your calcium levels can go very low if they are taken out inadvertently or injured in the process. You also have your nerves there that control your voice box. So some people get hoarse when those nerves are cut or injured during the process.
Then if the thyroid is removed, there's no other source for thyroid hormone. So if your thyroid is removed and you cannot produce sufficient thyroid hormone levels, then you will develop the hypothyroidism, which is easily treated, as we mentioned earlier. You just take hormonal replacement therapy of thyroid hormone.
Okay, so that is the effect of taking it out. How about the radiation that you mentioned?
Radioactive iodine.
Radioactive
You can become hypothyroid after that, or you can have a normal thyroid function after that. So it really depends on how much radioactive iodine you got and how much thyroid tissue is left behind.
These treatments are available here.
Yes, yes. Like, radioactive iodine has been around for more than 50 years.
Okay. And we talk about the treatments. We have a question from Facebook that also addresses that. Are there medicines that can help prevent thyroid problems? So, have it, take it before you have it. Is that proper?
Unfortunately, there's none. So there's really no medication we can give to prevent it. So some people, kasi they think, I'll just, take in a lot of iodine. Unfortunately, as Joy has mentioned, if you take in too much, it can also prompt a thyroid problem. So basically, no, there's nothing we can take to prevent, unfortunately.
There are a lot of people that keep taking these kelp
that's
supplements.
right.
Okay, self-medication again.
Yeah.
Not really a good idea because you might take too much iodine in the
Just
process.
so they protect their thyroid, they'll self-medicate, or like the question, they want to take in something already so that it doesn't become overactive or underactive.
Unfortunately, there's nothing we can give for prevention for a thyroid problem, really. So there's nothing we can give for that. There's nothing for prevention.
How about in kids who have a hyperactive or an underactive thyroid? Medications also, or would you also recommend radiation? How does this go?
There's a certain age that we don't give radioactive iodine to, no. So generally, below 16, we don't want to give them radioactive iodine.
Okay, so it's just taking
the medications.
How about medical breakthroughs when it comes to solving or addressing thyroid problems? Are there new developments?
No, it's been relatively stable. And I guess the medications we have, they do work. It's just a matter of knowing how to use them, when to use them, at what dose, and to monitor for side effects. And to educate your patient that not just because you're on the medication, you can opt not to see your doctor anymore. You really have to go see the doctor regularly.
Because sometimes there are side effects to the medication. There are breakouts that might happen, or there are functions in your body, or you feel different from, sometimes you opt not to take them because maybe you feel more tired, or maybe your skin becomes worse. So, but you just have to continue because it's normalizing or regulating the hormones in your
And the doctor
body.
has to actually titrate the dose, which is perfect for you because each patient will really be different. So we just have to tell them to be patient, to come back, and we'll be titrating those dosages for them.
So any advice, doctors, that you would like to share with all our viewers on how to take better care of our thyroids? We don't really notice it being there, or we don't really understand its function until it signals that there's something wrong. So how do we take good care of our thyroid?
Well, basically, just live a healthy life. But I would like everyone in the audience to take a look at their necks. Look in the mirror. Take
Self-test.
a look. Yes, look in the mirror and try to palpate your neck and thyroid and see if there are any lumps there. And definitely, if you have any lumps, please go to your doctor right away and have yourself checked out.
Oh, you mentioned lumps. We cannot not talk about the topic of thyroid cancer. Let's talk a little bit about that. So how does this develop, and the treatments and cure for thyroid cancer?
Well, for thyroid cancer, usually it will manifest as a mass or a lump in your thyroid, and usually it's faster growing than the other kinds of lumps, which are benign. And compared to other cancers, most of the thyroid cancers for most patients are better treated compared to the other cancers. All we need to do is to completely remove the thyroid, and we do the radioactive iodine therapy, and we do give levothyroxine therapy suppression as well. And they just have to, sometimes, patients, they don't want to see the doctor because, sometimes I don't want to know that I have cancer. But you see, I will use the word curable.
Yes,
Because
okay.
for thyroid cancer, we can do that if we catch it early. So I think that's another message. If you have a lump in your thyroid, don't be afraid to go to the doctor because we can easily, well, potentially cure that if we catch it early enough. So you have to go see the doctor right away.
Okay. Doctor?
Yeah.
So, well, we'd like to thank both of you for helping us understand more about our thyroid, helping us take good care of our thyroid. And, you know, we should do a self-test, self-check. It's easy when you look at yourself in the mirror every day,
Yeah.
do that test. Thank you very much, doctors. Again, I'd like to thank Dr. Joy Castillo Fontanilla and Dr. Rochelle Cauton-Valera for joining us in our discussion. See you again next Tuesday on MedTalk, 10 p.m. on your scheduled on-air consultation on the Solar News Channel. This is Angel Jacob. Good night.
Depression because of the support of our doctors.
According to a 2010 study of St. Luke's Medical Center, thyroid cancer ranked as the 4th cause of death among women in the Philippines. Thyroid problems arise when there are imbalanced hormones produced by the thyroid.
Simple signs and symptoms that can lead you to the diagnosis of having a thyroid problem. Well, number one is most people are concerned with weight. No? You gain weight or lose weight very fast. These are probably signs and symptoms of having problems in metabolism. Second is
This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
if you notice, you can look at your neck. If you notice there are enlargement in the neck or some hard nodules in the neck, that is already a sign that you have probably goiter, no? An enlargement of the thyroid gland.
Several treatments are now available to help patients with their thyroid disorder.
There are now a variety of ways to manage the thyroid. Of course, there is surgery, but even in surgery, no, we have the minimally invasive. If you don't want to have a scar, we do that here in St. Luke's. No? And if you have what we call a minimally invasive surgery, we also do it here. And we have
It seems like destiny played a prank on 31-year-old Apple Roma. Apple, a medical technologist, has been working as a section manager at the Diabetes, Thyroid, and Endocrine Center of St. Luke's Medical Center for 9 years when she was diagnosed with thyroid cancer.
Nagtuturo kasi kami ng ultrasound ng thyroid sa mga trainees namin. So, minsan nagiging test patient ako, tapos yung partner ko nagtuturo. So, this is the thyroid, this is the right, the left, the middle, and the carotids, ganyan. Tapos, accidentally, nakita na may bukol sa right thyroid. After nun, ma-recommend for biopsy, lumabas nga na thyroid cancer siya.
To prevent further damage, Apple underwent a surgery to have her thyroid removed.
Nakaka-depress din nung una. Kasi I have to undergo surgery and then therapy. Kasi more or less, alam ko kung ano yung mangyayari sa akin. Naka-recover din ako mabilis after nun.